So, to first of all, heart disease and COVID-19 infection, they go hand in hand. In fact, somebody who has already had a heart attack or has a LV dysfunction has got more severe prognosis of COVID-19 infection. To come to the point that COVID-19 does not only attack the lungs, but it also attacks heart. The COVID receptors wherein they attach the cells are not only present on the lungs, but they are also present on the myocardium, and that is why you also get, along with the viral pneumonitis, you also get what is called as COVID myocarditis. In fact, the presentation of COVID myocarditis is exactly same as the other myocarditis or acute coronary syndromes. Sometimes you do get presentations of patients with purely cardiac, such as breathlessness, chest pain, sweating, syncopal attacks, ECG changes suggestive of non-ST-EMI. In fact, it is quite indistinguishable from a classic NSTEMI. Now, how do we really know? Then sometimes you do get sometimes history of COVID infection, such as fever or a viral prodrome of sorts. But every time during the pandemic, whenever you get a little atypical presentation of a NSTEMI, you should always keep COVID myocarditis at the back of your mind. Now, how is the prognosis? If COVID-19 infection is associated with pneumonitis and heart problem, then the mortality increases 3 to 4 folds. Mandeep Mehra and his associates from Harvard have brought out an excellent paper which also says that whenever you have a myocardial injury, that is troponin I or CRP, which is on the higher side, that means there is a myocardial injury, the mortality increases many folds. In fact, troponin I is a very important prognostic marker along with D-dimer, ferritin, interleukin 6, hemogram, and so on and so forth. So, whenever you get such patients, always make it a point to do a D-dimer and a troponin I along with other markers for COVID severity. In fact, the risk of COVID related cardiac disease comes and persists for many weeks after the infection has been recovered. So, to summarize, whenever heart disease is associated with COVID, it makes the prognosis worse. Secondly, COVID can directly attack heart disease and cause various presentations such as viral myocarditis and STEMI, and that particular presentation of COVID is very severe as compared to a normal COVID or COVID pneumonitis. And that is why it is very important to pick this up at early stage by doing various markers such as troponin I, high sensitivity CRP, and other NT-proBNP and other markers. That is the way you can actually diagnose associated cardiac involvement in COVID and take an preemptive action and prevent it from progressing further. Thank you.